Good evening. Good evening. My name is Patrice, and I am a member of the African American Community Partnership Group, AACPG. And it is my honor tonight to be having an open conversation with Dr. Mary Roberson on addiction, recovery, and recidivism. Dr. Roberson is a resident of Lake County, and she has served Lake County for over 25 years in human service and behavioral health service. She was the managing director of Nakasa Behavioral Health. She's a military vet. Dr. Roberson has served on state and local boards, and she is the founder and executive director of NERCO, Northern Illinois Recovery Community Organization. So I would like to welcome Dr. Mary, and Dr. Mary, welcome and thank you.
Thank you. It's an honor to be here.
So, Dr. Mary, as I stated, you have over 25 years serving Lake County and working in human service and behavioral health. I know that you worked with the Veterans Court, you worked with Mental Health Court, you've done so much. And can you just please share with our audience your experience on the disparities in the behavioral health services that's impacting the African American community?
Yes, thank you so much, Patrice, and all of your board and the other members of this particular group. One of the things that I always like to do is look up certain words, and I looked up the word disparities because I hear that word thrown around quite a bit, so I want to make sure that I had a clear-cut definition. And one of the things that I discovered in that definition is that a disparity is a great difference or a difference in access to treatment or a difference in outcomes. So when I look at that particular question, for my particular experience on disparities and impacting the African American communities, and I always like to say our communities of color, because I think it's important that we include our brown and yellow brothers and sisters in this as well. But my experience is that some of the differences are socioeconomical in nature. You know, sometimes based on a person's income level or their ability to get health insurance. I thank goodness for the Obamacare, healthcare bill that came out when he was president, and that gave a lot of people access to treatment. But I think that's one of the biggest things is that, you know, if you don't have health insurance, it's difficult for individuals to get behavioral health services. And behavioral health services can include substance use treatment. It could include mental health. It could include physical health, you know, like addressing diabetes or obesity or heart disease or any of those kind of things. So in my experience, you know, when I was working with NACASA and when I worked at the Department of Veteran Affairs, a lot of times communities of colors, they really didn't have, you know, that access. You know, sometimes we had to offer sliding scale fees or reduced rates and things of that sort. And with the Department of Veteran Affairs, you do a means test, which basically means you're looking at that person's income and see if they're eligible for services. So those are some of the great differences, is that access, you know. And the other part too is when communities of color that's got lower economical status and then they cross our doorways and come into our various organizations and agencies, you know, it's imperative that we as the providers treat them with dignity and respect. You know, sometimes, you know that we have a huge homeless population here in Lake County, and there's times when, you know, the homeless population who need these services may not come in with a three-piece suit or, clean. They may come in, you know, after sleeping in the parkway for many days. So just having, you know, that ability to help them out and things of that sort. So. Yeah, those are some of the things in my experience.
Well, what I heard you say, and thank you for that. You really covered a lot of ground in that. You know, I heard you speak on mental health and homelessness. Um, why do you think substance use disorders are viewed differently than mental health disorders?
Well, so I grew up in the Chicagoland area, which is in Cook County, and during those times of growing up, again, it was the heroin crisis back in those days. It was the cocaine epidemic. It was individuals standing on the corners or around garbage cans, as we say, and those individuals were considered to be, bringing those situations on themselves. So a lot of time the mindset in the distant past was that substance use or addiction or alcoholism was brought on by a moral deficiency, if you will, and mental health. That being differently, like, okay, a person might have been born with schizophrenia, or well, not born with it, or had an onset at age 21, or someone, experiencing depression, they would talk about, oh, that's a mood disorder. So the big difference is, society sometimes think that substance use disorder, alcoholism, and addiction is brought on by the person, whereas mental health is just maybe a chemical imbalance and things of that sort. But through my many years, Patricia, being a clinician and an educator and a person in recovery myself, I know that it's basically the same. The challenge is a person is faced with some challenge, whether it's cocaine, alcohol, or depression or anxiety, that really needs the help that Lake County has been able to offer.
Okay, and thank you for that. Because being a prior clinician, I do know that with substance abuse being viewed differently, a lot of people don't understand that it is actually a mental health issue and a diagnosis. And you talked about the health disparities as far as the physical health. All of them have been crises in our community or in the community of color. And you spoke on heroin use. And so America has faced this opioid crisis, and it has destroyed families in communities, especially in the communities of color. Do you think that enough is being done to address or combat those crises in these communities?
So, you know what, that's a very interesting question. Throughout my many years as a licensed clinician here in Lake County, we've seen so many generations that's been impacted by, addiction, the war on drugs, and all of those kind of things. With the opiate crisis, a lot of my clinician friends or colleagues, they would, say that, it didn't become a crisis until it was whitewashed, if you will, the kind of quote my friend, Kathy Kane Willis. It wasn't a crisis until it was impacting our suburban white brothers and sisters, but we know that that it's been a crisis for many, many years. We hear a lot of people talk about the heroin highway, which is the 290 Eisenhower leading into the intercity. So your question, is there enough being done about it in our communities? I think that they're beginning to do something, but when the crisis would first start being highlighted, when our young white brothers and sisters were overdosing in their parents' basement, and there was a national call out, with the pain meds, and then there was this discussion about people are accidental addicts. It was a lot being done on that side of the fence. But there was, and we talk about this in our community, there was Lil Joe, Pookie and them that was being impacted just as well, but it wasn't anything being done about it. And one of the things that I always say, Patrice, is that if we as people of color African Americans are not at the table and making our voices heard and voicing our concern about our young people, then no, it's not going to be a lot done about it. Our white brothers and sisters, when their kids start overdosing, they start going to their congressmen, they start going to the legislator, talking about we need to do something about this. They start making their voices being heard. So I just think it's important that we as African Americans, we need to, again, continue to sound the alarm, just like we're doing with the social unrest, when all of this stuff with the opiate crisis and we still overdosing in our communities, we have to sound that alarm.
Absolutely. I agree with you. More can be done, and it's unfortunate that the only way that it was highlighted is because our Caucasian brothers and sisters were being impacted, but now the light has been shone on it. And so hopefully we can continue to move the conversation forward and continue to get legislation and things put in place to help the community of color.
I would like to just interject this, that I'm a big part of the Lake County Opiate Initiative, and I really like what they have been doing with the Way Out program. And I talk quite a bit with, Mike Nearheim, Bruce Johnson, Chelsea Labradee, and all of those individuals that started it. And one of the things that they created was this Way Out program where you could walk into a police station with your paraphernalia and say that, hey, I want to get some help, and they'll help you to get to treatment. And it was open to all, and it was various police departments around the county that was doing it. What we found when we started reviewing the data of the individuals that was utilizing that program, there weren't a big number of African Americans or Latinos taking advantage of that. And you want to know the reason why? Some of the things that we kind of talked about is that, African Americans and Latinos, they're not going to walk into a police station and say, hey, I want to get some help, because of the distrust and the fear of other things happening as a result of that. So, sometimes we have to really kind of look at the big picture, if you will, to see why these things are taking place.
Absolutely. And so that brings me to another point and question, because what I'm hearing with the disparity and with the community of color being ravaged by the opioid crisis, and then the fear of seeking help through the Way Out program, how do you think trauma has influenced addiction? And how do you think it hinders an individual in their recovery process?
So, I know that trauma is an emotional response to something that's happened. I often talk when I'm, seeing a person in counseling or recovery support or doing a class on trauma. There's various degrees of trauma. There's a lot of different layers. A lot of times when people hear trauma, they think about, PTSD as it relates to veterans in a war. But in the Black and Brown communities, there's a lot of traumatic events that take place that impact individuals just like a war zone. For example, gangland shootings, drive-bys, finding somebody deceased in the alley from an overdose, or somebody being lost in a fire, because someone was smoking in bed. Those are all layers of trauma. So it's a connection between that and how that impacts addiction. Because when someone is traumatized and they don't want to face, what we call those repressed memories, or if they be coming up and they having nightmares and flashback, people tend to use substances to, deal with that, to cope with those things. And that's how sometimes people, experience trauma. They use substances, they become, addicted, and then next thing you know, they're pretty much out of control. So there's a correlation between that. because I think about my, own life. I grew up in West Garfield in Chicago during the 60s. And, and I know you probably saying I don't look like it, but that's all right. I still got that little cute baby face, right? But I grew up on the west side of Chicago during the times of the vice lords and the gangs and the heroin crisis that was going on. And there was a lot of traumatic events that took place right in our communities. The Martin Luther King riots on West Madison Street, when they burnt all of that down, that was a traumatic event. When they start having, a lot of the race riots or the shootings and things of that sort. So a lot of that stuff leads to people having to cope. And sometimes we don't, the communities of color don't have the ability to cope and go and talk to a therapist or go and talk to your mom or your dad. They just start abusing substances, and it leads on to that. So that's the correlation in my experience and what I've, seen with clients that come into a Nakasa or a Gateway or, a Lake County jail and things of that sort.
Okay. And
did that answer your question?
It did answer the question, and you talked about the multi layers of trauma and how it impacts individuals. But you said something, Dr. Mary, that was real key, like seeking help and or going and talk to a therapist or to a family member. Growing up in the African American community, always was told that didn't have to go and seek treatment for anything. You could just pray and it'll be okay. Can you just speak a little bit about how you have seen our community pivot, like, and begin to seek out those types of services? Because for so long, it was a stigma for a Black person to seek any kind of mental health treatment. So can you just talk a little bit about that and how you've seen that change and how, we are starting to, seek out those services, and what more can we do?
Yeah, so one of the reasons that I started NERCO, and you guys could visit my website at www.nercolakecounty.org to see the services that we offer. But one of the things that, throughout the years of my education and throughout the years of my professional experience, it was really troubling to me that a lot of individuals in our community didn't seek out the services. I could remember, again, being in the family systems where my mom or aunt would say, what goes on in this house, stay in this house, or I don't want nobody knowing my business and things of that sort. So a lot of our community members, they wouldn't go into it. And then the other piece of it, and I was talking to someone from Rosalind Franklin University about this, when communities of colors did decide to go into to get some help, the environment was so, I'm going to say this term again, whitewashed, that they didn't feel comfortable, saying what they needed. And then on the other side of it, the clinician, the doctor, the nurse, the reception didn't give them the opportunity to really kind of express what they need, and sometimes that prevents people from going in to get the help. Regarding stigma is such a, a stronghold, I'm going to say, on our communities, because a lot of us, myself included, before I got educated on the services, or didn't want to be perceived as being crazy. That language that we use, or there's something wrong with Uncle Joe back there in that room, and just give him a plate or something along those lines. The stigma of substance use disorder, the shame of mental health kept a lot of communities of colors from going in to get their help. That's why it's imperative that we as providers and the groups that you guys are doing, I really admire what you guys are doing, because you're letting people know that it's important to be able to receive people as they come in. So stigma is about shame. Stigma is about embarrassment. Stigma is about the language that you use. So I often say that we need to change the language. We need to watch the words that we use, and we need to let people know there's nothing shameful about going in to get behavioral health service.
Absolutely, absolutely. So you talked about your organization, NERCO. Can you? I want to first talk about a little bit about treatment, just real briefly, and then talk about what recovery is and the difference, and then let's talk about turning this around, how we can move into the recovery process.
Okay, thank you. That's a good segue. So treatment is when people go in to get detox. Treatment is when you are going in to kind of move out of the environment, so to speak, to get the medical help that you need, whether it's for addiction or whether it's for mental health. I always talk about treatment as, you know, the road in. And then recovery is, you know, where you get, it's the supportive services that you get once you're out of treatment. So we know that a person going to, well, they don't go in 28 days no more, but back, you know, a time ago, they was a 28-day, we'll say a 7-day treatment for substance abuse. They get the education, they get detox, and now they return to their home environment. The recovery piece is the supportive services that kick in. That's why I love NERCO so much, because NERCO offer those recovery support services. And the recovery support services be right in the person's community, helping them to get the recovery capital, to manage their recovery so that they don't return back to relapsing, because everybody can't move out of their neighborhood and go into a drug-free environment. Everybody can't go into a recovery home and pay the cost of that. Sometimes you have to go right back to your own environment. But recovery and recovery support services and mutual support groups are there to help a person to maintain this journey.
Okay, well, thank you. We actually have a question from Sharon Smith, and I believe it's how can we deal with trauma in recovery? I believe that's the question. I hope I
Can you repeat
captured
that,
that.
please?
How can we deal with trauma in recovery? So I believe what the viewer is asking, if someone presents with trauma, how can they begin to address it while in the recovery process?
See, that's a touchy question, because if a person is experiencing flashback, uh, hypersensitivity, I mean, hypervigilance, and all of those things that's related to trauma, sometimes it's mental health services that's going to help with that. Now, as a person go into the recovery process, maintaining whatever that therapist has told them to do, if they're, you know, going to meetings, you know, making sure that they're not being triggered. If they have like a mentor or a sponsor or someone that's able to walk them through, you know, the journey of step work. So it's important to make sure that you're not confusing the two, because there's mental health counseling or mental health services, and then there's recovery support service. It depends on the complexity of the trauma. You probably would go the mental health route, but if it's something that a person has had some time to work on in the recovery community, just staying clean, making sure they're taking their medication, and making sure that they're not involved in anything that's gonna trigger any of those repressed memories and things of that sort.
Okay, all right. Thank you for that. Um, so you talked about treatment and you just talked a little bit about recovery. Um, we know that in the recovery community, there is the traditional 12-step programs. You have your AACA, NA. Can you talk a little bit about alternative pathways to recovery and how critical they are to individuals and families seeking recovery.
Yeah, I'm really glad you asked that because I always applaud the work that the 12-step community has done. You know, I'm a 12-step baby myself. You know, as I said a little bit earlier, I'm a person in long-term recovery. I've been in recovery for 28 years. And you know, through the VA and through, you know, a 12-step community, and a lot of my friends are still involved in the 12-step community. It's a big difference, you know, when a person say, you know what, I'm not really into that, you know, sitting in the meeting, or now we're doing virtually. There's multiple pathways that people could get to recovery, and sometimes it's through, you know, mental health. Uh, Sometimes it's through virtual tele-counseling. Sometimes it's just talking one-on-one to someone. It's not always a person has to go to a meeting. There are some people that really don't like going to meetings. I was talking to some friends last week, and they have family members who really don't believe in that. But that doesn't mean that they can't get the help that they need for their substance use disorder, because there are multiple pathways. And one of the things that, again, NERCO, we pride ourselves in is we offer that. If you just want to come in and talk to a recovery coach or a peer support specialist, we offer that. And, you know, we would help with, again, instructing individuals on how to create recovery capital and be able to manage recovery from that standpoint. You know, if you want 12-step, you know, involvement, we would direct you in that pathway. If you want to do Celebrate Recovery, which is a spiritual based, you know, mutual support group, or Smart Recovery. It's so many different pathways that people could go through. It doesn't necessarily have to be through all the A's, as we call it.
Okay, so Dr. Mary, you said a few things. You talked about recovery capital, someone connecting with a recovery coach and a peer support specialist. Can you just give us an example, like what is recovery capital to the individual in recovery? Can you give maybe a couple of?
Sure, sure. So my one of the men folk that I admire, other than my husband, is William White, Bill White. He's the guru of recovery management. And way back, you know, I always say way back in the day, back in the past, when they first started with the Project Safe programs with the Lake County Health Department and the CASA, one of the things that he talked about was we need to help people to develop capital, meaning like what kind of social support, what kind of human support, what kind of financial support do they have so that they can maintain their recovery. And recovery capital is just that. What's in your life that you could pull from socially to help you to stay in the recovery process? What's the capital that you have? And the other thing is, what is the human capital? Do you have relationships? Do you have a place to live? Things of that sort. It's all of those things that's like, when you think about financial capital, you think about how much money you have, right? Where recovery capital is, what are the things that you have that's going to help you to sustain your recovery?
Okay. So it looked like we had another question that came in from audience member. And I know that you kind of hit on it early on in our discussion, but if we could just go back to revisit that, for the community of color and not having the resources or the finances to seek treatment. Can you just speak a little bit to some services that you know that are available? Because I heard you speak about the sliding scale fee and stuff.
Well, you know what, with COVID-19, you know, hitting us in the gut the way that it has, I'll speak pre-COVID. So
Okay.
pre-COVID, if an individuals had a medical card, they could possibly go to an organization that, you know, received those Medicaid offer those Medicaid kind of services. If a person is in a certain income level, but they're not in, the high range, again, there's sliding scale. And what I mean by sliding scale, that the treatment services will be based on your income, and you wouldn't have to pay full amount. So those are some of the options there. United States veterans, depending on, what your discharge status was at level federal healthcare system, you could go there. There's resources in the community like the Lake County Veterans and Family Services Foundation. For them, it doesn't matter what type of discharge service you have, they're gonna help you to link up with services that you need. So there's a lot of different alternatives. It's just the individuals, they have to really do the research and really have to have the willingness to walk through that door. Patrice, the hardest thing is for people to walk through the door to say, I need some help. And that's why I implore our community members that may be listening and maybe be suffering or being impacted by substance use disorder or mental health, put pride to the side and pick up the phone and call someone. It's Suicide Awareness Month. We know that there's been an increased number of African Americans that's taken their lives. So I just implore you guys, if there's a need, you call NERCO. I could hook you, well, I can hook you up, but I can connect you to resources, because when you start saying hook you up, sometimes our community, holler at you, hear me, you got the homegirl hookup. No, but what I'm saying is I could connect you to the services that you may need.
So, well, I really enjoyed this very open and candid conversation on addiction and recovery. Dr. Mary, you said pre-COVID. How has COVID impacted our recovery community?
Wow. You know what? We've been having some major discussions about that in various coalitions and groups that I've been a part of. COVID has caused a lot of people to isolate, and with that isolation, it brings about increased anxiety, increased depression, and things of that sort. But the way to cope with that, and we continue to put this out there, is there's virtual services that's available. Just because you can't walk in and visit, well, now you can, because of the different phases that the governor and our county board enacted as far as opening back the state and also our county. But there's virtual service, there's telehealth services, there's services that you could do via Zoom, which is virtual. I mean, it impacted where people were like, feeling suicidal. People were increasing their substance use. If you go on the Lake County Coroner's website, you'll see that there's been an increased number of overdoses. But there's services are available. It's just a matter of just tapping into them virtually. Now organizations are receiving. We're located at 202 South Genesee. So if there's anyone that's in need of services, stop in and see me or call the number that Ms. White put on the page, and we'll be able to help you as best that we can.
Okay. So we have another question that came in, and it speaks to the homeless population that wants help, and where can they go to get that help?
Well, our partners at PADS, they have done a wonderful job. A lot of times people give PADS a bad rap, but our partners at PAD has been doing a wonderful job in sheltering people. I believe that they're receiving clients now to do intakes and things of that sort. And then there's other organizations. For example, NACASA has a homeless program, but again, it's in connection with PADS. So you go through PADS, do an intake, and they refer you over to NACASA for mental health services, for housing navigation, for peer and employment support. So there's a lot of places that the homeless population could go. It's just a matter of, sometimes the cognitive functioning of some homeless individuals and being chronically homeless may impair them. So having someone to advocate for them would be really, really helpful. So PADS, NACADSA, some of the shelters that's around, yeah, they're opening back up. And then the other part is the 211, call 211, find help Lake County, 211.
Yes, that is a very valuable tool. Uh, 3 numbers, 211, and you can call and get connected to the available resources throughout Lake County. Again, Dr. Mary, I have really enjoyed this very open conversation about addiction and recovery. Um, you continue to talk about NERCO, the Northern Illinois Recovery Community Organization. So as we wrap up, can you just tell us a little bit more about your organizations, the type of services that you provide, and take it away, Dr. Mary.
Yeah. So NERCO, Northern Illinois Recovery Community Organization, that's my baby. Oh my God, I love it. So as I talked a little bit earlier, I'm a person in long-term recovery, and I've been in this community for almost 30 years. I work with judges and attorneys and Waukegan Township. It wasn't until maybe about 4 years ago I started talking about my own recovery, because I hear some of the comments that people, or some of the language that people use when they're talking about individuals who previously had a substance use disorder. And that language was very unbecoming at times. So I got connected with Faces and Voices of Recovery, which is a national advocacy organization that says just that. They want to put a face and a voice to recovery. And when I got involved in that, and I would travel across the country and I would see all of these politicians and attorneys and corporate individuals saying that, hey, my name is Joe and I'm a person in long-term recovery. And what that means is I haven't used any substances for however many years. I'm like, wow, did they just say that on a national platform? And they, and talking to them afterwards, they say, yeah, because we want people to know that people do recover. And there's a lot of prominent individuals that are in recovery. So fast forward, retire from the CASA. And I'm like, you know what? I want to leave a legacy in the community. That's where I grew up in recovery, where I grew up professionally, and NERCO is the legacy. NERCO is the first and only recovery community organization here in Lake County. And that is very significant because the state and the federal government recognize recovery community organizations because it's for people with, it's driven by people with lived experience. Those who have been there, done that, can help the ones that's struggling. We even have family members who are involved in NERCO, because not only does substance use and mental health impact the individual, it impacts the family too. So we invite family members to come on out and talk about, some of the things that you're struggling with, and here's some alternatives for you. So NERCO provide those peer-based, peer-driven service. We do recovery education, recovery advocacy, or this being National Recovery Month. This is part of my recovery advocacy and recovery education being on here. So we're a 501c3, independent. We're right in Waukegan. We cover the whole county. And check this out, Facebook. We're going to be the recovery-oriented system of care here in Lake County, which means that we're going to be calling out any of you all to come and be part of making Lake County a recovery-friendly community. So that's what NERCO is all about. That's how you cope with these things. Please don't be ashamed. Come on out, because I'm willing to say that someone on this Facebook or even on this call, you have a family member somewhere that's been impacted by substance use disorder and mental health. Come on out and be part of making recovery the new cool.
Well, I like that. Recovery is the new cool. Well, Dr. Mary, I would like to thank you on behalf of the African American Community Partnership Group, AACPG.
Well, can you,
For
before we end up, can you tell me a little bit about what you got, who you guys are and what you do? I know that I hear the acronyms. Tell me a little bit.
about. So I'm a member of this wonderful group. This group came about in looking at the health disparities with the COVID crisis. And so what our mission is to help with those disparities, to provide PPE and to partner with the resources that's already in the community, to come alongside of them and to assist them in ways that will help to dispel those disparities and those health challenges.
Okay.
And it's a wonderful group. We've already dispersed numerous of kits. People can get masks, the disposable masks, the reusable masks. Actually, I believe that we will be having a PPE distribution this weekend. So go to our website on Facebook and check us out. And again, Dr. Mary, thank you. It has
You're
been
welcome.
an honor and a privilege.
Well, you are quite welcome. Thank you. That's good stuff.